Hello. Thank you for joining us. Welcome to Feed Forward, brought to you by the Illinois Podiatric Medical Association. Joining me today is Dr. Kosova,
Yes.
who practices in Naperville, Illinois. Before we go much further, do you want to talk a little bit about your practice, just a little?
Yeah, the majority of my practice is sports medicine. I'm lucky enough to be in Naperville, which is sort of sports mecca, and we're able to see a lot of kids, both adults and teenagers, basically playing all sorts of sports. In my practice, a lot of them are playing at a very high regional and national level, and it makes it very interesting.
All right. Well, today's topic is podiatric treatment of sports injuries. And just a reminder, this is your forum. So if you have a question about foot or ankle injuries, whether they pertain to sports injuries or not, feel free to give us a call at the number listed on your screen, and Dr. Kosova will be more than happy to answer your questions. Now, could you explain a little bit about what podiatric sports medicine is exactly?
Well, the difference between a regular practice and a sports medicine practice is the people that I see, I need to get back to their athletic ability rather quickly. So you might have somebody who just has an ankle sprain, and I might, at an average person, they might be out of their activity for a couple of weeks. But when you have somebody who's a national or regional level, let's say soccer player or a gymnast, sometimes I literally have a week to be able to get them back to actually compete on that regional national level. So that's what really makes it challenging and fun.
All right. Oh, that's fascinating. Oh, just a little sideline. We are having a promotion on our Facebook page, and we'll discuss a little bit more about that later. But just to go on about your practice, I know you see a lot of performance type sports people. Uh, could you explain exactly what type of injuries or give examples of what sort of treatments you extend to your clients or to your patients?
Yeah, I mean, a lot of them are tendon ligament type of injuries that we're going to see, or with the ligaments and the tendons around the foot and the ankle. Um, a lot of them basically, are a little bit more severe than the average person just doing it. And a lot of these kids and adults have a little bit more at stake. Some of them are looking to get college scholarships, and this might be their only chance and way of going to college. Some of them basically, I just had a dancer who was in New York. We were talking about this a little bit before, and on the New York stage, she actually ruptured her ankle and fell off the stage, and she's one of the leading 13-year-olds in the United States for dance, for competitive dance. For her, when we actually had to look at what treatments we were going to do for her, it ended up being a surgical repair. But the way that I had to repair her was different than the way that I would actually repair somebody else, because I need to keep flexion in her ankle versus take away, the ligament laxity or the ability to sprain her ankle with her ankle going out than I would somebody else.
When you say someone else, like for instance me, how would you treat someone like me differently as compared to this dancer or
It's
this
a great
athlete?
question. When we're treating somebody, we always go conservative first. So you're doing a lot of wraps and ice and crutches and maybe some casts and other types of walkers to support the ankle and support the foot. And once you get down the swelling, you really see what the true injury was. But with her, we were on a timeline to get her ready for another competition coming up a couple months later. So she's working with both a New York and a LA choreographer, and it was, again, this is a different level of person than maybe what you're doing on the weekend. But with her, I needed to keep flexion in her ankle because of the type of ballet moves she does and the type of dance she does. And somebody who's not doing dance, let's say they're a football player, then we don't want to we want to support that ankle a little bit more. And when we're doing surgical repairs, we actually want to tighten up the ankle. So in a dancer, what makes the sports medicine aspect so interesting is I can't do that. I actually have to still repair her and keep her ankle loose.
Oh my goodness. Um, lately well, not just lately, but there have been a rash of foot and ankle related injuries to sports players. And they've been rapid. I mean, they've been frequent. You've heard so many mentions this year alone on people or sports figures getting plantar fasciitis and whatnot. What do you account for this exactly?
It seems like, if you go back 10, 15 years, you never really heard of plantar fasciitis. You never heard of so many foot and ankle injuries to the professional players out there. And it seems like, and especially with our own Jakeem Noah with the Bulls and Derrick Rose hurting his knee, that all of a sudden you're hearing the word plantar fasciitis, heel pain, the fibers of the plantar fascia sort of tearing. A lot of this I kind of contribute to not so much the shoes that they're wearing, because I think pretty much over the last 10 years, the basketball and we'll just take basketball as an example, basketball shoes are pretty much the same. Some have a little bit more padding, some don't. I think it really comes down to the training they're doing on the off season. The trainers are actually using their mental, physical ability. I think some of these players, probably are not doing everything that they're supposed to be doing in the off season, and they come in a little bit tight, they come in a little bit cold, and then you hear about this whole rash of injuries.
Now, when sports, I know that there is a specific, when talking about shoes, there's a shoe for every sport. Could you, and I would think that, and most people would probably think that if your kid or whoever is in sports, you know what shoe to put on your foot. But could you go into like the proper shoe wear for, I mean, it's obvious basketball for basketball, but the proper shoe wear for for certain sports?
Yeah,
The popular sports?
even though you're saying basketball for basketball, I just had a patient that's actually, again, he's a nationally ranked basketball player. He's about 14 years old, but he was training for basketball now, so he's doing cross country. So he was running cross country in his basketball shoes, which don't give the same support. A running shoe has a lot more support, a lot more cushion, and what happened is on the bottom of the foot, he actually tore some musculature. Actually, we were talking about the plantar fascia. It's exactly what happened to him. And, I talked to his parents, just what you were saying. When you play basketball, you put on a basketball shoe. I have a patient that was playing basketball in a running shoe to make it a little bit more confusing and sprained his ankle because he doesn't have the same support. Running shoes are for forward and backward motion, mostly forward. Basketball shoes are for up and down and sideward motion. So you have to get the correct shoe for the correct sport.
Now, when specifically for run, well, let's just sidetrack a bit. What advice do you have to offer for people running? I mean, purchasing running shoes exactly. We have some pictures that we can show you.
So with this is a really good one. What we're looking for is heel counter rigidity. And what we mean by that is when you take the shoe, you want to grab it sideways and just basically squeeze into it. And a lot of the shoes that are just not well made, when you go to squeeze on them, they squeeze very easily. And that's telling me that you're losing control. You want to take your heel goes into the heel counter, and you want to give it control. So especially running shoes, you're going to notice that possibly your $30 pair of running shoes are going to be really easy to squeeze when we're going in this way. But when you start getting into the $70, $80, $90 running shoes, the better made ones, you're going to find out that this has a little bit of a heel cup around this to support your heel, to give it the support and the rigidity it needs when you're going forward. So that's always something that's really important. The other thing that we look for when we're looking at running shoes is, there we go, is the sole of it needs to be flexible. So when you're taking the shoe and you're taking the shoe here, you want to kind of move that shoe up in your bendability. Where it bends, you want it to bend right at the ball of the foot. When you go to these secondhand stores, and sometimes like in Kenosha, there's the outlets, and there are outlets all over, they'll get secondhand shoes, and a lot of times the shoe will actually bend over here, or it might even bend over here. And you want the shoe to bend where your foot bends. And if it doesn't, then you get friction, you get blisters, you could get straining of your tendons and ligaments, and just the overall fit usually doesn't fit well. If we're speaking of running shoes, up in this area here, you want that to be the newer ones. You're going to see there's a lot of mesh, and there's a lot of ways of letting air in to basically cool down the foot so it doesn't heat up and you don't get things like athlete's feet, that kind of thing.
Okay. Now, when speaking about running, there's been it hasn't been that popular. I haven't seen it mentioned too much lately, but maybe a year or two ago, the craze was barefoot running, where people actually ran in their bare feet, long distances, not just like walking to the end of the block. Could you explain how barefoot running affects your feet, and whether or not it's good or bad?
Yeah, there were actually a couple different crazes. One was barefoot, the other one was minimalistic shoes, which we still see a little bit now. And what happens is when you're taking an average athlete, let's say myself, and you're just going for a weekend run, and you hear about this new craze out there, and I want to try it, I want to see if I could do it, you have to be extremely conditioned to run barefoot on grass and cement, especially in the city of Chicago. And you have to be smart.
Yeah.
If you're running on the sand along the lakeshore or at a beach or wherever, you do have some shock absorption ability. So this came about because the elite runners were trying to build up some of the musculature of their feet with the theory that they would have stronger feet, and a stronger foot would actually lead to faster times. When you take the average person who's trying to increase their speed, just by supporting the foot muscles and making them stronger doesn't really equate to a faster time. There's really no report that's out there that's going to say that. So then out of that came, okay, let's protect our foot, so let's make a shoe, but let's make the shoe lighter. Let's take up the shock absorbent material. Nike, Adidas, Reebok, all the major companies, New Balance, Saucony, they all sort of went to this lighter shoe, but what we're finding out is, at least in my practice, I'm seeing more stress fractures of bones. I'm seeing more tendonitis of the foot ever since the lighter weight shoes came out. And the funny thing about all this month, New Balance and a lot of the other shoe companies are coming out with the exact opposite. The industry is going 180 degree on its head, and they're actually coming out with shoes with more shock absorption that are heavier, most likely because the minimalistic shoes just didn't work out so well.
Yeah, those light shoes are everywhere. Those light running shoes, they're very
Right.
pretty though. They have them in nice colors and everything. Now, when it comes to running shoes, when do you know, or how do you know when it's time to replace them?
Typically, we recommend about 500 miles. Most of my long distance runners, if they're doing a lot of triathletes and just marathons, or the shorter distances, 5Ks around the neighborhood, a lot of the more serious runners actually will log their times, and they'll log how much they ran per week, which is a great suggestion for the viewers watching. So you kind of have an idea. If you know you're doing 20 miles a week, then you just basically add that up. When you get to about 500 or 600 miles, that's when the soles of the shoes tend to start wearing away. And if we go to this picture here, you could see that just by looking at the back of the shoes that you see some wearing away on the inside of both of these shoes, where they should just be basically the same height on both sides. So they're kind of tilting in just a little bit. And that is really not good, because you could get ankle sprains and you could get knee pain and hip pain by not having the shoe being supportive, going back to checking the heel counter and what have you. So 600 miles is a really good mark. Honestly, most patients, probably about a year is when they're thinking about changing them.
Now, another arsenal, or something that's very important to an athlete, or any person for that matter that exercises. What about socks? How important are socks for the athlete, or someone running, or?
Well, it's funny because Chicago Marathon is this weekend, and a lot of my patients, because of the barefoot craze, run without socks. And the number one complaint out of anything that I get is getting blisters on the feet, and especially blisters on the feet and your toenails actually coming off during a run. When you're wearing a sock, you're actually having the shock absorption. It's another layer of shock absorption. Plus, you're taking the perspiration from the foot. It's actually absorbing it. and it's actually decreasing the chance of getting friction between the toes around the foot itself. So, for everyone listening, definitely wear socks when you're running in your running shoes. Don't go barefoot because you're just going to run into trouble.
Okay, which brings us to, as I promised earlier, our Facebook promotion. Please, this was created just for our CAN TV viewers. Visit our Facebook page. The address is right there. It's just facebook.com/Illinois Podiatric Medical Association. And if you like us, we will give you a free pair of, and here they are, Dr. Scholl's blister, women or men's blister guard socks. They're very good for what Dr. Kosova was just speaking about in regards to keeping those blisters at bay, because you don't want a blister when you're running or jumping or doing any sort of strenuous physical activity. As a matter of fact, Dr. Kosova, you don't, when we do I should say the podiatrists have a tent at the Avon Walk, which is held every spring. And the doctors see hundreds of people who come in there to get their feet treated while they're walking, or so they can continue their walk. And the vast majority, 99% of the patients have blisters. So it's not just for running, it's for walking too. So if you're walking, keep that in mind. Now, let me see. Another question regarding runners, athlete's foot, or anyone, or a sports person, athlete's foot. This is a very annoying ailment a lot of sports people or athletes suffer with. How do you treat it? And most importantly, how do you avoid it?
Okay, well, where a lot of patients get athlete's foot is, especially kids, if they're in the gym class in middle school or high school and they're taking showers. And it's the same thing whether for you, if you're working out at a club and you go take a shower in the club, there's usually carpet. And you go barefoot into the shower and you take your shower and you come out. What you're doing is you're actually picking up other people's, what we call fungus or athlete's feet, and sometimes warts also. And so one thing I always recommend is wear some sort of sandal or shower shoe of some sort. Don't go barefoot in places that aren't your own home, because you will pick up something, and we see this all day long. A lot of people, look at athletes' feet and they're like, oh, it's just some peeling, it's not a big deal, and little Johnny has it and it'll go away. If you go, since we're talking about sports medicine, if you go back to Michael Jordan, when he was playing, he was hospitalized because he had, between his toes, he actually had a fungal infection that he didn't do much about, and it turned into a bacterial infection, and they actually put him in Northwestern for a couple of days and IV antibiotics just because basically of a fungal infection that wasn't treated. So ways to avoid it, basically, wear your shower sandal, that kind of thing. There's antifungals that you can actually use. Since we're talking about socks, changing your socks. A lot of the kids will have gym at like 12 or 1 o'clock. In the afternoon, we tell them if they could change their socks to a dry sock, not a wet one, when they're in school the rest of the day. That's a great thing, because fungus and warts both grow in dark, wet places, and that's basically our shoe. And especially, at noon or 1 o'clock, if you're playing basketball for gym, and then you're wearing those same wet socks until you get home at 3, 4 o'clock in the afternoon. So changing socks, you could use powder. Sometimes you have to come in and see a podiatrist to get a prescription cream to put on, but it's very, very common, especially in the adolescent community.
Now, in regards to exercising in the winter months, which we're quickly approaching, a lot of times, especially runners, they try to find alternative ways to exercise. For instance, they want to do alternative indoor fitness trainings like, treadmill, or working out on a treadmill. Now, what advice do you offer people who participate, and I'm going to pick a few of my own, who participate in activities like step aerobics or Zumba?
Yeah, anything to keep you moving and grooving and losing weight and keeping active in my mind is great, and I don't care what activity it is. But you also have to be sort of physically built for some of these activities that are out there. I have lots of patients that want to run indoors, so they'll go on a treadmill. My own personal thing is when I go on a treadmill, my left knee hurts me. When I do, indoor running on a track, I don't have any knee pain. So I figured out really quickly, treadmill's not my thing. So you have to pick something else that's going to maybe simulate what you're trying to achieve. Um, and really kind of be prepared for it. The key thing, like we were saying with Zumba or with step aerobics, we have a lot of patients with injuries with step aerobics. I actually treat trainers, people who teach step aerobics come in with injuries. Is really being prepared ahead of time. And it's really with any athletic endeavor, whether it's indoors or outdoors, having a good warm up regime, maybe riding a bike for 5-10 minutes, doing some stationary running, just to get your heart rate up, maybe do some light weights or band work at the club, depending on where you're at, and then go ahead and do your step class. But you have to stretch your legs out. And if you're not stretching your feet and your ankle and your legs, prior to doing it and you're going to do a step class cold, in other words, your step class is at 4:30 and you got there at 4:29, you're going to have some injuries because you're going to get muscle pulls, you're going to get lactic acid in the muscles, and it's just going to build up and you're going to get tears of the muscles and the tendons, and that's what we want to avoid.
Okay. We were talking about some, the injuries related to sports ailments, which and plantar fasciitis came up. Could you expound a little bit on that? Because it's not a name you hear or a word you hear every day.
Yeah,
What exactly that is?
plantar fasciitis is the tissue on the bottom of the foot. This isn't 100% showing it here, but it goes from the heel and it goes to the toes. And it basically is a band to keep all the muscles and the tissues sort of together. And what happens is that right in here you start getting some pulling and some tearing. And people have different theories of why that actually happens. It gets inflamed. And when something gets inflamed, it starts to break down. And when it starts to break down, you start to get small tears within anything that we're talking about, whether a tendon or a ligament or what have you. And it just starts to get more inflamed. You take some Motrin, which is anti-inflammatory, a brand name, unfortunately, and you're icing it, you're stretching it, you're trying to get all this inflammation out of it, but we're humans, so what do? We have heel pain on Tuesday, and on Wednesday we're going out and running. And that's one of the major things is that if you have any type of pain, you really want to get off of that part. What I tell most of my patients is that you want to get off, you want to ice it, take an anti-inflammatory if you're able to, if it doesn't contradict with some other medication that you're taking, and raise your foot and maybe wrap it. And you do that for a couple days. If you continue to have pain after 2 or 3 days, then I would go in to see a podiatrist and get it evaluated.
Right. What about ankle injuries? That's a big issue with sports figures too.
Yeah, I mean, with ankle injuries, it's really the ligaments around the ankles that get stretched out and they get torn to some degrees. There's, 3 grades of ankle sprains, and, grade 1 is just twisting fibers, and grade 2 is you're starting to tear, and then grade 3 is you actually have a rupture. So again, I would see a podiatrist, get that evaluated.
Right. Was there anything else you wanted to mention on treatments or precautions regarding sports-related foot and ankle injuries?
Well, if you have an injury, and again, if it's not going away after a couple days and you've iced it and you've done some other things to try to make it better, I would definitely go in and see your pediatrician if you're a child, see your podiatrist, get it evaluated, and really get off of it until you're able to perform at a higher level.
All right. Well, thank you for joining us on Feet for It. Now, I want to remind you that we have some free socks waiting for you on our Facebook page, so please go and like us. It's created just for you. And also, just remember that if your feet hurt, see a podiatrist. Thanks, and we'll see you next time.
Bye-bye.
Bye.